the president of regional and local government, where all the councils are responsible for management of health services from the level of the community up to the level of the district hospitals. And this is done mainly by also support through regional administration, where now the POLAG is the one who oversees. So Tanzania generally had a very successful immunization, and this was mainly due to establishment of the primary healthcare system since the Alma Ata Declaration 1978. And this has been done mainly to ensure that the community had the ownership of the services that are being provided, but also there is a multi-stakeholder engagement in the collaboration at the local level, and also integration of the service in such a way every individual in the community is able to access the services holistically. So in this, POLAG mainly ensure that access to services is ensured so that every individual can access immunization services as close as much as possible. So in this case, POLAG ensure that we construct facilities in every village, but now we are going to strategic construction in such a way where there is a need, depending on the number of the population that needs the services, is ensured. So these are the main issues that are being done. Not only that, but also we make sure that the councils budget properly for all the required intervention, including immunization services. And on this also we supervise and monitor closely how the services are delivered. And the issue of HPV vaccination, the gaps have been mentioned slightly by the program manager, but mainly we have noted that we still have challenges in terms of adequacy of resources allocated for immunization services. For quite some time, most of the intervention have been donor funded, but now we are more advocating to domestic funding, where now we are seeing a moderate increase of domestic resources, such a way the facilities now are able to plan and budget on their own, including budgeting for outreach and mobile services at their local facility, using own resources that they generated at the level of the facility. And on this, we have seen a significant increase of domestic funding, where the past 3 years, the funding have almost tripled from almost 80 billion to 268 billion. These are the funding which are generated locally at the level of the facility. And these actually are budgeted for all the interventions, including immunization services. Although we are still seeing most of the funding, especially tailored to capacity building and the other cold chain monitoring devices, these are mostly still donor funded. But despite all of these efforts, we are still challenges such a way that local prioritization and identification of the required villages or classes for immunization is still not well synchronized. But also one of the challenges that we are seeing is that monitoring of the individual client when they move from one facility to another is still a gap. In such a way, a client might have a vaccination at one facility. When they migrate to another facility or village, there is no proper linkage in such a way, she will still be termed as missing the second dose while she has received it at another facility. So these are still the gaps that we think as a sector we still need to address. But also, as I mentioned earlier, the resources are still inadequate, but also the need to continue to build the capacity of healthcare workers is still a challenge. Not only that, but also the community structures that are actually fundamental in ensuring that we have stable immunization services. There are still some areas where the governance structures at the local level, they are still not taking up the health services as their primary function. This is one of the very important aspects of primary healthcare in such a way that the community should take lead and ensure that the health services are delivered. And this is one of the challenges that we are seeing, that the community should take lead and ensure that the health services are delivered. And this is one of the very important aspects of primary healthcare in such a way that the community should take lead and ensure that the health services are delivered. And this is one of the very important aspects of primary healthcare in such a way that the community should take lead and ensure that the health services are delivered. they should be empowered to make sure that they prioritize health on their own. So this is an area which we are still struggling to make sure that the facility governing committees link our facilities with the general community in such a way that they take lead where children who need to be vaccinated should be on the front line. So this is in a nutshell the role of biology, but also the current gaps and the challenge that we are facing in the general. Thank you very much.
Thank you very much, Dr. Chaote, for that enlightening talk about those aspects from the POLAG perspective, as well as those challenges that we are currently facing as the country. Now let us turn our heads to Professor Mshana from KUAS, who has, as I said, has done a lot of research in the area. He's a guru in the area, and he's going to tell us what has been done in terms of HPV vaccine research in this country. Professor Mshana, the floor is yours.
Thank you, Professor Koko, for the question. I think what the audience needs to know, the number of researches that have been done in relation to HPV from different institutions, from NIMRI, KSMC, Uganda, MUAS, and it's clear, as you said earlier, 30% of cancers in women are contributed by cervical cancer. And there's a clear link between cervical cancer and HPV. There's a study which was done in Rwanda and the other centers which showed that about 50% of cervical cancer they are linked with HPV type 16 and 20% are linked with HPV type 19. So 70% of cancer they are linked with these two HPV types. So that's the clear relation. But also, group in namely Rwanda showed clearly that girls around 9 to 14, about 32.something% they are infected with HPV types, and mainly they are 16 and 18. So there is clear link in the evidence that cancer of cervical is linked to HPV. So researcher groups also in Tanzania went on and tried to see how are these HPV types are distributed. So we have a study from KSMC, from Mwanza, from Mumbiri, from Morogoro. Clearly they have showed that HPV type 16, 18, 52, 55, which are high risk, they are all over Tanzania. And now the researcher, with the clear evidence from WHO, different vaccines came in. And we all know about the vaccine which cover 2 serotypes, 4, 9. They're all there. And all these types which are covered in these vaccines, they are present in Tanzania. But another big study which was done in Rwanda, which is called Doris trial, which tried to evaluate between multiple doses. We all know that we are giving these girls number of doses, but for them they evaluated how can a single dose be enough to give protection for these HPV-related morbidity, especially cervical cancer. And this study concluded that single dose is almost as efficacious as multiple dose, with more than 90% efficacy, as that one which has been documented with multiple doses in number of pre-qualified WHO vaccines. So this is another very strong support which came with that we need to invest on the vaccine, try to prevent HPV-related morbidity, especially cervical cancer. So this is another area of research which has been done here in Tanzania. So there's when you look at the other studies which were done, trying to look for acceptability of the vaccine, there's a study which was done by FRA and groups, which show that at least there is a lot of awareness of cervical cancer in Tanzania. but little awareness that this cervical cancer is linked with infectious pathogen. And this pathogen can be prevented with vaccine. So these are some of the areas which we may need to invest more. So in short, a number of research have been done in Tanzania and in the other parts of the world that have clearly shown that HPV vaccine, they are really prevent HPV-related morbidity, especially cervical cancer, with about 99% efficacy. And some people may ask me if there is any cross protection, because we have more than 100 serotypes, more than 100 types, which we have documented many here in Tanzania. But the vaccine we are using, some of them there are 2 types, some 4 types, some 9 types. The one which was used in those trials was that of 9 types. But the study have shown that the cross protection, that being given these 2 types can protect other natural infections. So there is a need really to continue advocating and vaccinating these girls. So I think to start with, there are some of the few research available in Tanzania regarding HPV vaccine and its efficacy.
Thank you, Professor Mshana. This is what he has been dwelling on, issues of research. Perhaps people might have questions later to ask you regarding those aspects of the research. The next panelist is our host. There's effective program READ. She has been supporting the government in different ways. This is what we know in general. But today we are going to be well informed very specifically. And Rita is going to tell us through this question, what is your role in supporting the ministry to implement HPV vaccination program in this country? Rita, you're welcome to tell to inform the audience.
Thank you. So maybe I start with what Girl Effect we are doing. So Girl Effect is an organization, it's an international organization. Globally, we are operating in several countries, like 5 countries. In Tanzania and globally, we are a demand creation and social behavior change organization, mostly focusing on issues on awareness, knowledge, but also social behavior change, ensuring the communities change the health-seeking behavior to be from negative to positive, and eventually accessing services. We work in collaboration with the Ministry of Health and PRAD, as our speakers, Dr. Tinuga and Dr. Charlotte has mentioned, several challenges that we are as a country facing on cervical cancer to these young girls. And our role as an organization that has expertise in, Dr. Tinuga mentioned about the challenges mostly on awareness and knowledge, especially on HPV, but also eventually we want these people to create a positive health-seeking behavior at the end of the day, themselves going to the facilities and accessing these services. So our role as Girl Effect, in collaboration with Gavi, the Vaccine Alliance, we are working very closely with IVD and Health Promotion Unit, but also PRAD in 4 regions: Katavi, Shinyanga, Mtwara, and Lindi. And we have a potential also of expanding to other regions. And in these regions, basically our role is to work in collaboration with IVD and Health Promotion Unit, together with PRAD, to ensure that we develop relevant content, relevant messages through different channels, where, as our speakers mentioned, Dr. Tinuga and Chaote, addressing the challenges which were just spoken, of people not knowing exactly the connection between HPV and cervical cancer. So ensuring that the channels, the expertise that we have, Girl Effect, we use different channels to communicate through media, social media, but also digital, and also going on ground to do several one-on-one interventions. Given that if you look at the data of Tanzania, mostly the missed communities are the ones that are really, the remote communities are really affected, not being reached with these services. So addressing that, having a mixed interventions in the community, ensuring that we are also reaching the ones that do not access through media and also through digital. And in this also we had, so we are also building from our previous program. In 2020-2021 we had a big one-year HPV campaign, which resulted to this other 4 years program in collaboration with Gavi, the Vaccine Alliance. So building on the lessons that we had from that program and ensuring that we develop the content that is relevant to the community of Tanzania, and ensuring that these young girls who are 14 years old in school and out of school are being reached by these services. So also working very collaboratively with the service delivery partners. We have different partners that we are working very closely, Japaigo, we have also other partners on ground that are also service delivery partners working in this area. So just ensuring that wherever, when we are creating demand, ensuring that this demand is linked to service delivery availability. So availability of supplies at the supply side, making sure that we cannot create demand and at the same time this young girl goes to a facility and find that there are no vaccines. So making sure that there's a linkage between these two. So you are creating demand, but at the same time making sure that these services, these vaccines are available, the providers are available, and also the facilities are also available. As he mentioned, as Dr. Chaote mentioned, the government is also really making good effort in making sure there are outreaches being provided in communities where facilities are very far. There are facilities which are more than 5 kilometers away, the villages are more than 5 kilometers away from the facility. So working in collaboration with the government, ensuring that when these outreaches are set or are organized, we conduct several interventions on creating demand and making sure that these people are able to go to those services, to those areas and get those services. So several interventions that we are experts in. We convey these messages through radio, sports, radio dramas, radio talk shows, but also TVC, television commercials and videos, but also social media, different social media platforms. But also we as an organization, we work through our brand, which mostly Fatma is going to talk more about it, making sure that through our Tujibebe brand, we are able to also to convey most of these health issues in that platform for young people to access and get knowledge on it. But also the other channel that we normally use is interactive voice response. I'm not sure if everyone knows that. Dialing a number, and through that number you get information that you require, ensuring the knowledge piece is being addressed within our communities, making sure that everyone understands, but also we have testimonies through that IVR. People who have already got the HPV vaccine can still testify, and people listen to that and get to remove the myths and misconception concerning HPV. But also apart from that, we also have several on-ground activation activities that are planned together with the government, involving very closely the council health management teams and regional health management teams, ensuring that these on-ground activations are regionalized, because we understand the setup of Mtwara and the setup of Shinyanga is totally different. So we work very closely with CHMTs and making sure that whatever on-ground activations that we are going to roll out in a region is mostly regionalized, and ensuring that this is applicable in that set of region, and not bringing something that is applicable in Mtwara and taking it to Shinyanga. Thank you so much.
Thank you very much, Rita, for such details. I think people were interested to hear that the effect. What is it all about? At least you have some clues, and perhaps later on you may wish to ask other aspects that you may wish to hear. And you have just, Rita, just mentioned one important person we are having here. There's no other than Fatuma. Fatuma, naomba kusikia kutoka kwako. Karibu sana ushiriki katika mjadala huu, na wewe ni mmojawapo kati ya watu wanaoweza kueleza au kufafanua vizuri yale aliyoeleza Rita, kwa sababu kama sehemu ya wanufaika. Je, unaweza kueleza ni lini ulisikia kwa mara ya kwanza juu ya chanjo hiyo ya HPV, na ni wapi ulisikia juu ya chanjo hiyo kwa mara ya kwanza? Tafadhali karibu.
Asante sana. Kwa mara ya kwanza mimi kusikia chanjo ya HPV ilikuwa shuleni, ilikuwa ni primary. Kama walivyosema mama, chanjo ya HPV ilianza mwaka 2018, basi mimi ndio nilikuwa nika 7 ndio nilikutana na hiyo chanjo. Nakumbuka hiyo siku tulikuwa darasani, mwalimu akatusoa wasichana tukaenda nje. Tukaambiwa kwamba kuna chanjo ya HPV ya mlango wa kizazi, lakini hatukupewa information yoyote zaidi ya kuambiwa hivyo. Kuna wengi sana walikimbia, lakini wachache tulibaki na tukachanja. Mimi nilikuwa na hofu, sikuweza kukaa nalo lile. Nakumbuka nilirudi nyumbani nikamwambia aunti yangu naishi naye, nikamwambia leo nimechanja chanjo, ananiambia HPV kuhusu nini, inahusu saratani ya mlango wa kizazi. Akaniambia usihofu kuhusu hiyo chanjo, mimi nina elimu kuhusu hicho kitu, sio kibaya. Akanielekeza kiasi, lakini bado nilikuwa na sije kumuelewa. Kuna siku nimekaa nyumbani, akaniambia hivi, kuna bridge za tujibebe, unatakiwa uende. Nikamwambia zinahusiana nini? Nikamwambia kuna siku niliuliza kuhusu chanjo ya tujibebe, unakumbuka? Nikamwambia chanjo ya HPV unakumbuka? Nikamwambia ndio nakumbuka. Akaniambia basi utaenda kupata information zaidi kuhusu hiyo chanjo uliyochanja. Nakumbuka nikaenda. Nakumbuka nikakutana na watu wa tujibebe, wakanisikilizisha redio, wana drama zao mule kutokea katika redio. Nakumbuka nikasikiliza. Jinsi kila siku ninavyosikiliza ile redio, yale maigizo mule wanavyotoa, wanasema umuhimu wa chanjo HPV, inasaidia nini, inafanya nini katika mwili wako, inasaidia nini katika future yako, inakujenga vipi, ndio ile nifanya nichanje chanjo ya pili ya saratani ya kizazi. Lakini bila kupata maelezo yoyote, kwa kweli nisingechanja, kwa sababu mara kwanza nilichanja lakini nilikuwa na hofu. Lakini tujibebe waliniwezesha kujua umuhimu gani na kitu gani kinapatikana nikichanja chanjo ya HPV, ndio nikachanja hiyo chanjo ya pili.
Labda unaweza kueleza huo umuhimu kusudi watu wasikie kutoka kwako ambayo umeshachanjwa?
Katika maisha watu hawawezi kutengeneza kitu kizuri ambacho hakina umuhimu. Kila kitu katika maisha kina umuhimu wake. Ndio maana watu wamekaa wakafikiria kwamba hii saratani ya mlango wa kizazi inatakiwa ipate suluhisho lake, ndio maana wakaleta chanjo ya HPV. Kwa hiyo kama wameleta basi ina umuhimu. Kwa sababu gani? Itanisaidia mimi msichana katika maisha yangu, katika future yangu kuishi vizuri. Kwa sababu gani? Kama sasa sijachanja na baadaye nikapata saratani ya mlango wa kizazi, unajua itakuwa ime affect katika maisha yangu na future yangu ya baadaye. Itakuwa ime affect kiasi kikubwa sana sana sana. Kwa sababu watu tuna imani fulani kwamba mtu ukipata saratani ni wanasema nini?
Mwisho wa maisha au
wanasema ni mwisho wa maisha, wanasema
utakuwa mgumba au uzazi.
Ni kiasi kidogo sana ni mtu kuishi. Yaani una umri mdogo sana kuishi, kwa sababu saratani ni hatari. Okay. Kwa hiyo ina umuhimu sana kuchanja kwa mabinti wote, kwa sababu itatusaidia katika future zetu na itasaidia katika maisha yetu, kwa sababu itatulinda juu ya saratani ya mlango wa kizazi.
Asante sana Fatuma kwa kutoa uthibitisho na ushahidi wa maneno ambayo ni ya muhimu katika kuhusiana na hii chanjo. What she is saying is about that she got vaccinated when she was in primary school, and previously she was not aware of this vaccine but when she was informed about this vaccine, she took the vaccine, and she informed the close relative that was the aunt. And from that, it's when she started with that progress. So she's a flag bearer of Tujibebe. Now, given the time that we have, perhaps panelists would want to hear from you if you have any comments or questions, so that if they have more time, they respond based on from your questions. I see a first hand there, second, third, fourth. Can we ensure that they have microphones so that they communicate? Yes. The first one is there. Let us be as brief as possible because the time we started a bit late, but it's important to get your questions or comments.
Okay, thank you. My first question will be directed to the office of the Pure Lad, and this is on the importance of empowering the young people in spearheading these advocacy activities. As we know, my name is Pascal Lucas from the University of Dodoma. I've been part of the team who have been actually spearheading these activities in the community, but we don't see any activeness from the Pure Lag offices like the dispensaries or the health centers or the, let's say the district hospitals, like empowering us who can actually take over. Like you have the vision, but we have the speed. We can cover a wide range of people in a short time, but we don't see that activeness, involvement of us. I could give an example, like from the University of Dodoma, we have an association that we've been partnering with Benjamin Mkapa Hospital, and we are spearheading out advocacy against breast cancer, cervical cancer, like going to the communities or sometimes into radios. We've been going to Dodoma FM, Mwangaza FM, Maisha Magic FM, like giving out this education. And what she has been saying is what we actually see in the community, but we don't see real commitment from these Pure Lag offices like the health centers that they are supervising. What's their commitment on that? Thank you.
Yeah. Thank you very much. The next here is, let us take the microphone here. Let us note those questions, then I will take around to answer them.
Sure. Thank you so much, panelists, for your interactive discussion. Two questions, which might also end up being two in one. To Dr. Chaote, being that the vaccine is actually being given to school-going children, assumed by virtue of their age, what is the working relationship, I mean, intergovernmental and multi-sectoral interaction with the Ministry of Education specifically to ensure that then the targeted population are met? And hearing from Fatuma, it kind of got me a little bit skeptical in the sense of what is GAL effect doing in issues to do with information education and communication to ensure that then there is a proper advocacy so that then they are not scared and running away from getting vaccines. I know that's a health matter. It shouldn't be at the school level because school is education. So what is the advocacy components and information aspects to ensure that then when you're rolling this out, being a health issue in education, they're already empowered and they already have the information. Thank you so much. And my name is Sam Okoth from Nairobi, Kenya.
Yeah, I rephrase the question to Fatuma. Fatuma anakuuliza, tutakuambia hilo swali baadaye, lakini anakuuliza ujiandae kuwaeleza hiyo chanjo ambayo inatolewa. Can you say that in Swahili? You are a Swahili speaker?
Jaribu.
Okay.
Haswa swali lenyewe sio kwa Fatuma hasa,
okay.
Ni kwa GAL effect.
Okay,
ni lipi wanalofanya kuhakikisha kwamba kabla chanjo yafikie wasichana wanakuwa na ile uhamasisho ndio wasiwe wanaogopa kuchukua chanjo walipochanjwa shuleni, manake alisema kuna wenzake ambao walitoroka.
Okay.
Uhamasisho gani inafanyika kabla watu wapewe chanjo?
I think girls effectively answer that. Yes, the next that one.
Thank you. My name is Innocent Peter. I'm a medical doctor. So my question basically comes because I wrote an analysis. I presented a topic presentation and an abstract presentation in France and Korea on HPV vaccine situation in Tanzania. some of the, this is a great opportunity for me to get, because I did that using the research that is presented on, publications that are presented online. Now it's a great opportunity to hear from people who actually implemented it. One of the things that we noted was the great variation in these 2 doses that we had 77% coverage for the first dose, and we had 46% coverage on the second dose. So one of the recommendations was that maybe we switch to single dose. But coming to this, what explains the first and second dose discrepancies of over a half? Maybe were we forcing them to get vaccinated as Fatuma did, or we had any other explanation on that? And another thing is, are we thinking on like where we are with incorporating this HPV vaccination into our national immunization program, which we have it for, we have had it for a very long time and it's quite operational. Thank you.
Thank you. I think the first question might be answered by Professor Mshana, and the other one about the program, Dr. Tinuga, I think can be in a good position to say about that. Let us go this way. Let us finish the 3 hands over there.
Nitatumia Kiswahili. Naitwa Aziza Asmani Abdalla, ni mwanafunzi wa daktari chuo kikuu cha Dodoma. Swali langu litaenda kwa organization ya Gelo Effect pamoja na Wizara ya TAMISEMI and Apollo. Swali langu la kwanza nilikuwa natamani kufahamu ni strategies zipi zimewekwa kwa Gelo Effect kuwahusisha wanaume katika awareness ya cervical cancer. Kwa sababu mara nyingi tumekuwa tukiona swala la saratani ya mlango wa kizazi linaachwa kwa wanawake peke yake. Hata kwa wazazi nyumbani, baba unakuta hata hahusiki kabisa kuhamasisha watoto wake wa kike kuhusu chanjo ya saratani ya mlango wa kizazi, na analiacha jukumu hilo kwa mama peke yake. Na swali jingine ni juhudi zipi ambazo zinawekwa na Gelo Effect pamoja na Poland katika kuhakikisha mwendelezo wa awareness ya saratani ya mlango wa kizazi. Kwa sababu mara nyingi tumekuwa tukiona hata katika social medias awareness kubwa inakuja kutiliwa mkazo katika mwezi wa kwanza tu, ambao ndio unachukulika kama ni mwezi wa awareness ya saratani ya mlango wa kizazi duniani. Lakini baada ya hapo awareness ile nguvu ya awareness inapungua. Huku kuna baadhi ya watu wanahusika katika hicho kipindi kwa sababu ya kukosa hiyo elimu, na kuna wengine ambao hawako engaged na mambo ya social medias. Kwa wazazi wanawake waliopo sehemu za vijijini au ambao hawana access na social medias wanashindwa kupata elimu hiyo. Lakini pia nimesikia kwamba Gelo Effect ipo katika mikoa 4 ikiwemo Shinyanga. Ninatokea Kahama ambao ni moja ya wilaya ya mkoa wa Shinyanga. Hapo Shinyanga, wilaya hiyo ya Kahama ambayo ni kwa sasa ni manispaa, kuna wanawake ambao bado kabisa ni wagumu kwenye swala la kuambia kwenda kufanya screening ya cervical cancer, na wanaishi katika manispaa. Kwa hiyo ni juhudi zipi ambazo zinawekwa na Gelo Effect hata kuzifikia tu hizo wilaya ambazo mikoa ambayo tayari wameshaanzisha programu hiyo? Asanteni.
Asante. The last 2 hands.
Asante sana. Nitatumia Kiswahili. Kwa majina naitwa Salome Mosha, ni kutoka Saratani AI. Na maswali mawili, moja litaenda kwa Gelo Effect. Sisi kama Saratani huwa tuna program pia tunaenda kwenye mashule kutoa elimu juu ya HPV and cervical cancer. Na tunatoa elimu kwenye shule za primary na secondary. Na tunatoa kwa mji hapa Dar es Salaam. Tulifanya mwaka jana, tulifanya Dar es Salaam, mwaka ujao pia tutategemea pia kufanya Dar es Salaam na Pwani. Lakini kwenye secondary schools wanafunzi kuanzia hata form 1 mpaka form 4 unaweza kusimama pale, unaanza kufanya campaign, ukauliza what is human papilloma virus, they don't know, hawajui kabisa. Sasa kama Gelo Effect mmechukua hatua gani hasa kwenye kupromote elimu kwenye mikoa mingine? Ni sawa, lakini mmechukua jukumu labda la kusema, kwa sababu mnafanya kazi na wizara, kuingiza hii topic ya HPV and cervical cancer maybe kwenye mitaala ya wanafunzi ili wafundishwe, kama vile mwanafunzi ambavyo anajua HIV ni kitu gani, ukimwi ni kitu gani, basi na wajue pia HPV ni kitu gani, kwa nini niwe vaccinated. Kwa sababu mwanafunzi ambaye yuko la 7 la 6 yeye ndio atakiwa apokee chanjo. Amesema hapo Fatuma kwamba walivyokuja watu wa chanjo wengine wote walikimbia, akabaki yeye pamoja na wengine wachache. Walikimbia kwa sababu gani? Hawajui what is HPV, hawajui what is cervical cancer, inasababishwa na nini. Lakini wangekuwa wanafundishwa darasani kama vile ambavyo wanajua what is HIV, ukimwi ni nini, ingekuwa ni rahisi kupokea chanjo. Kwa hiyo ningependa kujua pia kama mmetazama swali hilo pia kushirikiana na serikali, Wizara ya Afya na Wizara ya Elimu ili kuweza kuingiza hicho kipengele kwenye mtaala wa elimu. Itasaidia zaidi katika kutoa elimu kwa wanafunzi. Iwe rahisi kwa kuweza kupokea chanjo. Hilo ni swali langu la kwanza. Swali langu la pili naenda kwa Mr. Steven. Kama researcher, je, kuna research ambazo zimefanyika on the HPV effect kwa wanaume, kwa sababu imeonekana kwamba kuna some types of HPV ambazo zina effect kwa boys and male, zinasababisha mouth, throat and male genital cancer. Sasa labda utueleze katika hilo kama kuna researchers and if there is possibility pia ya kuingiza watoto wa kiume katika kupewa vaccination. Thank you.
Asante. Nafikiri tuna maswali mengi lakini tumalize na mwisho alikuwa amenyosha kama muda utaruhusu, maana baada ya dakika ngapi? Dakika 25 zina kazi nyingine baadaye. Lakini tutaona kama muda utaruhusu. Karibu. Tuende very briefly.
Hello. Okay, my name is Dr. Serafina Mkua. I work with the AMREF with Africa in Tanzania. I have 2 questions. The first one goes to Dr. Tinuka. You've talked about the dropout effect of class 7, who are mainly the group which is being vaccinated, meaning the 14 years, perhaps for class 7 or class 6, but mainly class 7 who received the first shot and then the second shot perhaps it takes place when they have already completed. So that's a risk. And I also heard from Professor Mshana that they still see the HPV infection occurs mainly at the early age of 9 years to 14 years. Now, your initial pilot focused vaccinating 9 to 14 years. So what is the plan that the government or the ministry is having, perhaps to revise rather than vaccinating at 14 years, then why not vaccinate at 9 years? Because the research that Professor Mchana shared shows that the transmission of HPV occurs at an early age. So these are like the early sexual debate that happen at a very early age. And we go vaccinate at 14, but we still miss 14 years who are out of the school and the 14 years who complete standard 7 before getting the second shot. So that was the first question. And the second one, I just want to reiterate my colleague question, which did not come out very promptly on regarding engagement of the Minister of Education. So we see all of you here is Pio Raj is
Can we be focused because we still have 5 minutes to finish?
Yes, I'm just finishing, Professor. And we see a lot of programs that are going through school program, vaccinating the 14 years in school, but we don't see Ministry of Education and engagement. So I would like also to know how is this Ministry of Education engaged in this whole process of vaccinating school-age girls. Thank you.
Thank you, Mkua. Yes, we'd like to get more questions, but we still have 6 minutes to wind up because 25 minutes we have other activity that's going to take place today. Perhaps if time allows, we may take any 1, 2 questions, but let us hear the response first. Welcome.
Thank you, Professor Koko. I think the first question to me was the coverage. I'm sure people from YVD will answer this correctly, but since the introduction in 2018, the coverage for HPV-1, I think in 2018 was 59%, then in 2022 it was 70-something%, with a maximum of 80-something%, it decreased during COVID. But for HPV-2 was 40%, and then in 2022 is about 56%. So there is always a difference between HPV-1 and HPV-2. I think the explanation has been given clear. When are you giving them, and where are you going to get these children? So when there's a school, you can get them. When they're out of the school, you don't get them, especially for this second dose. And I'm sure the Ministry of Health is coming with a strategy of changing from 2 dose to single dose. I think it's going to address a lot of these coverage issues. Regarding male, I think this is a very good question, issue of equity. And I'm sure the Minister of Health is thinking about that, because the HPV also do occur in males, and it can cause cancer, penile cancer, and this has been documented in a number of research. But there's the issue of cost effectiveness. Investing in males, investing in girls, and the cost related, and what are you going to achieve? Those are the issues which is under discussion. But due to equity, it's right for the males to receive that vaccine. I think the Minister of Health is working on it.
Yes, thank you. Next.
Thank you very much, moderator, for the opportunity to respond to a few issues raised for Piolage. I would like to comment on all the comments and the answers that have been provided by all the participants. Respond to the first issue on the issue of advocacy in general, and that we are not seeing a lot of advocacy happening at the level of the facilities. Yeah, in general, health promotion in our country is done in 2 tiers. That we have those that happen at the local community, which we are usually using this. We conduct this in collaboration with the community health care workers and the peer educators at the level of the community. This is extensively done in almost all interventions, and we have quite a number of partners who have been supporting us to make sure that we capacitate community health care workers to advocate immunization in general and respective to HPV for those who are out of school. For those who are in school, we are doing this extensively involving at the local level. I mean, in schools, we involve the school teachers. And in this case, we have capacitated health, a focal person for health in every school. So every plans to go to the outreach services are usually conducted in conjunction with the healthcare workers by communicating with the school coordinators, but also all head teachers for the primary schools. Before we started this program, there were sensitized on this immunization in general. We still have a way to make sure that we continue to build the capacity, but also advocacy even to the head of schools, because as we know, we have turnover of our staff in general. In such a way, they move from one school to another. So this is an area which we are continuing conducting. And the other issue is how we involve other sectors. For this case, we have engaged from the national level. The health promotion in general in schools, HPV is one of the components that is now incorporated as one of the issues that have been to take place in the schools. But also at the level of the region and at the level of the council, all the regional education and the district education officers, they are aware of these interventions, and we regularly review performance and then put strategies together to make sure that the performance in schools is improving. So this also happened with another speaker on the issue of engagement of the education sector. I think I have also explained. So essentially, these are the issues that have surfaced for Piolage. Thank you.
Thank you very much. IVD manager.
Thank you. The first question is HPV vaccine under immunization program? Yes. Immunization program manages the vaccines, which includes vaccine for children, meaning under 5s, the vaccine for girls, the HPV, and also vaccine for adults, which is COVID-19. So it's under the program. The other question was given the discrepancy in coverages and all these issues we have seen, the uptake and others, plus the science from the studies, what is the government thinking? So the government is thinking to do two things. One, to introduce the HPV from 9 to 14. So we are going to shift from 14 to 9. And this has been encouraged after having confirmation of availability of the vaccines. So HPV vaccines availability is 100% super available. The second thing the government is going to do is to change from 2 doses to single dose. So that will answer the question of dropout. Thank you.
Thank you, Dr. Tuniga, for that assurance. I'm sure people were waiting for such statements, and now they are happy of that. Yeah, the last one is our hostie. Can you be so focused? You have several questions for the sake of time for the other activity.
Yes, thank you so much. So there are strategies that we have set for schools. Firstly, is to work very closely with all sectors, Ministry of Education, Ministry of Health, but also PRAG, but also working very closely with other partners and other existing structures which are already there. Like there are other partners, and also the government has school clubs. The initiative is to avoid what Fatma faced, is to make sure that these young people are informed in advance, they get the information in advance, getting why HPV, what is it related on, before going to be vaccinated, just making sure that they have a more deeper understanding prior to them being vaccinated. So that effort will continue, but also making sure that even the ones that are out of school, because we can not only think of the ones in schools, but also making sure that we use different existing structures where we can get access to parents and